Hi friends, welcome back to my channel. Today we can see laboratory diagnosis, treatment and prophylaxis of dermatopytosis. In lab diagnosis, the history of the patient is very important. That is age, occupation, hobbies, living conditions, duration of the disease, intake of previous medications, etc. Diagnosis can be done using microscopy, culture and serological methods. First we can see direct microscopy. The most important method employed is KOH wet mount. It is very simple and reliable. Skin scales, nail clippings, hair stubs, etc. are the main specimens examined. We have to disinfect the affected site with 70% alcohol before sample collection. Then scrape from the center to edge. In the case of hair, we have to take the hair from the basal root portion, that is we have to pluck the hair. Then mycelia with arthrospores can be seen. Demonstration of fungus in nail is very difficult. The nail clippings, they must be kept overnight in KOH before observation. Nail clippings can be stained with PAS or GMS stain and it is more effective. Calcofluor fluorescent stain can also be used in the case of nails for seeing fungal hyphae and spores. Second method is fungal culture. Three genera of dermatophytes are there: Trichophyton, Microsporum and Epidermophyton. They can be recognized based on the morphology of Macroconidia and Microconidia. Macroconidia, they have typical shapes in different species and are very important for identification. Shape, arrangement of spores bearing hyphae and also the presence of some vegetative structures are helpful in identification. Specimens should be inoculated on fungal culture media. Dermatophytes can be easily grown on SDA with antibiotics and cycloheximide. Media is incubated at 3 temperatures, 25 degree, 30 degree and 37 degrees Celsius. They are slow growers, usually take 10 days to 3 weeks for attaining growth. Dermatophytes, they form pleasant colored colonies. Rice grain medium can be used for differentiating Microsporum species. Dermatophyte test medium can be used for presumptive identification. The media turns red if it is positive. Dermatophyte identification media helps to identify and to avoid false positive results associated with dermatophyte test medium. SDA with thymine can also be used to see sporulation. Urease test is done for differentiating Trichophyton, Mendagrophytes and rubrum. That is, Mendagrophytes, it is urease positive and rubrum is urease negative. Hairbrush sampling technique can be done using a plastic hairbrush. Hair perforation test can also be used for differentiating the different species of Trichophyton and Microsporum. Hair perforation test is positive for Trichophyton, Mendagrophytes and Microsporum canis. Cultural characteristics in SDA. Trichophyton species, they form powdery, velvety, waxy colonies with pigmentation. Colony morphology and pigmentation, it varies with species. Here Microconidia and Macroconidia are present. Microconidia are the predominant forms and they are abundant, arranged singly or in clusters. Macroconidia are rare, smooth-walled, pencil-shaped with blunt ends with 1 to 12 septa. Here this is the white mycelial colony of Trichophyton rubrum with red pigmentation on the reverse side. Second one is Microsporum species, cottony, velvety or powdery with white to brown pigmentation. Predominant conidial forms are Macroconidia. Large, rough-walled, multicellular, spindle-shaped macroconidia can be seen. We can see 1 to 15 septa and this macroconidia are formed at the end of the hyphae. Microsporum gypsum, it has board-shaped macroconidia. Microconidia are very less in number. Here we can see the Microsporum gypsum showing macroconidia and microconidia. Epidermophyton species, only one single species can be seen, that is Epidermophyton flocosum, no teleomorphic state. Identification can be done by morphological characters and biochemical analysis. Here Microconidia is absent. They are slow growers, powdery, greenish brown, white, suit-like surface raised and folded in the center. 1 to 9 celled, smooth, thin-walled, pear or club-shaped Macroconidia can be seen and they are abundant and are arranged in clusters. Here this is the colony of the Epidermophyton flocosum and this is the Macroconidia. Microconidia is absent. Here Trichophyton, macroconidia, here it is rare, thin-walled, smooth, but microconidia is abundant. In the case of Microsporum, this macroconidia, it is thick-walled, rough and are numerous. Microconidia is rare. Epidermophyton, here also we can see numerous smooth-walled macroconidia, but microconidia is absent. This is the macroconidia of Trichophyton species, and here Microsporum species and macroconidia of Epidermophyton species. This is the microconidia. Here we can see single microconidia or microconidia occurring in or appearing in grape-like clusters. Next is Wood's lamp examination. It is invented by Robert W. Wood in 1903. Used first for the detection of fungal infection of hair. It contains Wood's glass. Wood's glass consists of barium silicate with 9% nickel oxide. Wood's glass or Wood's filter, it is opaque to all light except a band width between 320 and 400 nanometers with a peak of 365 nanometers. That is, it can transmit only UV light and shows characteristic fluorescence. Chemical substance responsible for this positive fluorescence is pteridine. Here, the fluorescence can be seen and different microorganisms are producing different fluorescence. For example, Malassezia furfur, it is producing golden yellow fluorescence, Microsporum canis, bright green fluorescence, and so on. This is the Wood's lamp examination. This is the Wood's lamp. Here, examining Tinea capitis, that is the dermatophytosis of the scalp. It is examined using Wood's lamp. Next is immunodiagnosis. Skin test with dermatophytic antigen, that is trichophyton, and serological tests are important for diagnosis. Trichophyton produce positive delayed type hypersensitivity, that is a positive reaction. Then immunodiffusion can also be used. Molecular tools employed are employed because they are rapid and reproducible. PCR is highly sensitive technique. Multitoph can be used. PCR fingerprinting can also be used for identification of species and varieties. Chitin synthase 1 gene analysis of dermatophytes can be utilized for distinction of clinically important species. Animal pathogenicity. For studying the nature of lesions and immunity produced by the organism, mouse, guinea pigs and rats are the commonly employed animal models. Next we can see the treatment and prophylaxis. Various topical agents are available. For example, Whitefield's ointment, azole derivatives can be used. Then orally we can take terbinafine, itraconazole for nail and scalp infections. A single dose of 2 gram griseofulvin can be given for Tinea capitis. Terbinafine, itraconazole, fluconazole, etc. can be used for treatment of Tinea corporis. Itraconazole and terbinafine can be used for onychomycosis. Clinical cure is the disappearance of all lesions. Mycological cure is the negative culture as well as negative microscopy. Live spore vaccines, killed hyphal cell wall and soluble cytoplasmic extract vaccines of Trichophyton mentagrophytes can be used. Here the live spore vaccine is more effective. Good personal hygiene is very important to avoid or to prevent dermatophytosis, and also avoid tight-fitting garments, avoid sharing of cutting blades, towels, pillows, combs, etc. so that we can prevent the dermatophytosis. That's all about the lab diagnosis, treatment and prophylaxis of dermatophytosis. Hope you'll understand the session. Thank you. Have a nice day.